50 Nursing Leadership Nclex Questions. Nclex Practice Leadership and Management questions are some of the most challenging on the Nclex because they test more than your nursing knowledge. They test your ability to prioritize, delegate, communicate, and make safe clinical decisions under pressure. In this video, you'll work through 50 carefully selected Nclex-style nursing leadership questions covering delegation, prioritization, assignment of tasks, conflict resolution, time management, informed consent, legal and ethical responsibilities, supervision of assistive personnel, disaster triage, and safe patient care. These are the types of questions that often make the difference between passing and failing the Nclex. So take your time, think like a charge nurse, and always remember to prioritize patient safety. Question 1. The charge nurse is assigning clients to the nursing staff. Which client should be assigned to the licensed practical/vocational nurse, LPN/LVN? A. A client admitted with diabetic ketoacidosis requiring hourly insulin adjustments. B. A client 1 day after a routine hip replacement with stable vital signs. C. A client experiencing chest pain awaiting ECG results. D. A client receiving a blood transfusion for the first time. Correct answer: B. A client 1 day after a routine hip replacement with stable vital signs. Rationale. The LPN/LVN should care for stable clients with predictable outcomes. Clients requiring complex assessments, unstable conditions, or blood transfusions should be assigned to the RN. Strategy. Delegate stable, predictable clients to the LPN/LVN. Keep unstable or high-risk clients with the RN. Question 2. Which task is appropriate for the nurse to delegate to an unlicensed assistive personnel, UAP? A. Assessing a client's pain level. B. Reinforcing discharge teaching. C. Measuring and recording vital signs for a stable client. D. Evaluating the effectiveness of pain medication. Correct answer: C. Measuring and recording vital signs for a stable client. Rationale. UAPs can perform routine, non-invasive tasks such as obtaining vital signs on stable clients. Assessment, teaching, and evaluation remain the RN's responsibility. Strategy. Remember, UAPs collect data, they do not interpret, teach, assess, or evaluate. Question 3. The nurse has 4 clients to assess first. Which client should the nurse see immediately? A. A client requesting pain medication for a pain level of 0.6. B. A client with a potassium level of 6.5 milliequivalent/L complaining of palpitations. C. A client awaiting discharge instructions. D. A client requesting assistance to the bathroom. Correct answer: B. A client with a potassium level of 6.5 milliequivalent/L complaining of palpitations. Rationale. Severe hyperkalemia can cause life-threatening cardiac dysrhythmias and requires immediate intervention. Strategy. Prioritize actual threats to life using the ABCs and unstable laboratory values. Question 4. Which task may the RN safely delegate to the LPN/LVN? A. Initial assessment of a newly admitted client. B. Administering oral medications to a stable client. C. Developing the nursing care plan. D. Providing discharge education. Correct answer: B. Administering oral medications to a stable client. Rationale. LPN/LVNs may administer medications and provide routine care to stable clients. Initial assessments, care planning, and teaching are RN responsibilities. Strategy. The RN assesses, teaches, plans, and evaluates. The LPN/LVN implements care for stable clients. Question 5. A newly licensed RN asks the charge nurse for help caring for multiple clients. Which response by the charge nurse demonstrates effective leadership? A. Figure it out on your own. B. You'll learn eventually. C. Let's review your priorities together and develop a plan. D. Ask another nurse. Correct answer: C. Let's review your priorities together and develop a plan. Rationale. An effective nurse leader mentors staff, encourages teamwork, and supports safe patient care through collaboration. Strategy. Strong leaders coach rather than criticize. Question 6. The nurse receives these assignments. Which client should be assessed first? A. A postoperative client with a respiratory rate of 8 breaths/minute. B. A client scheduled for discharge in 1 hour. C. A client requesting a blanket. D. A client waiting for lunch. Correct answer, A. A postoperative client with a respiratory rate of 8 breaths/minute. Rationale. A respiratory rate of 8 indicates respiratory depression, placing the client's airway and breathing at immediate risk. Strategy. Use the ABCs. Airway and breathing problems always take priority. Question 7. Which action by the charge nurse best promotes effective teamwork? A. Assigning all difficult clients to one nurse. B. Encouraging open communication among staff. C. Ignoring staff concerns. D. Completing every task personally. Correct answer, B. Encouraging open communication among staff. Rationale. Open communication improves collaboration, reduces errors, and strengthens patient safety. Strategy. Healthy communication is the foundation of effective leadership. Question 8. The nurse is delegating care to a UAP. Which task should not be delegated? A. Assisting a stable client with bathing. B. Feeding a client without swallowing difficulties. C. Measuring intake and output. D. Assessing a client's skin for pressure injuries. Correct answer, D. Assessing a client's skin for pressure injuries. Rationale. Skin assessment requires nursing judgment and must be performed by the RN. Strategy. If the task requires assessment or clinical judgment, it cannot be delegated to a UAP. Question 9. A nurse discovers another staff member preparing to administer the wrong medication. What is the nurse's priority action? A. Ignore the situation. B. Report the nurse after the medication is given. C. Stop the medication administration immediately and intervene. D. Wait for the charge nurse to notice. Correct answer, C. Stop the medication administration immediately and intervene. Rationale. The nurse's first responsibility is to protect the client from harm by preventing the medication error. Strategy. Patient safety always comes before documentation or reporting. Question 10. The charge nurse must assign a newly admitted client with pneumonia. Which nurse should receive the assignment? A. A nurse already caring for 4 unstable clients. B. The nurse with the lightest workload and appropriate clinical experience. C. The nurse preparing to leave for lunch. D. The newest nurse regardless of experience. Correct answer, B. The nurse with the lightest workload and appropriate clinical experience. Rationale. Safe delegation considers both the nurse's workload and competency to ensure quality patient care. Strategy. When assigning clients, consider patient acuity, staff competence, and workload, not just the number of patients. Question 11. Which client should the RN assign to the UAP? A. A client requiring sterile wound irrigation. B. A stable client needing assistance with ambulation after surgery. C. A client needing discharge teaching. D. A newly admitted client requiring assessment. Correct answer, B. A stable client needing assistance with ambulation after surgery. Rationale. UAPs may assist stable clients with routine activities of daily living, including ambulation. Assessment, teaching, and sterile procedures are RN responsibilities. Strategy. Delegate routine, predictable tasks to the UAP. Question 12. A client refuses a prescribed medication. What is the nurse's priority action? A. Document the refusal and notify the healthcare provider. B. Hide the medication in the client's food. C. Ask another nurse to administer it. D. Tell the client refusal is not allowed. Correct answer, A. Document the refusal and notify the healthcare provider. Rationale. Competent clients have the right to refuse treatment. The nurse should educate the client, document the refusal, and notify the provider. Strategy. Respect patient autonomy while ensuring proper documentation. Question 13. Which client should the charge nurse assign to the most experienced RN? A. A stable client awaiting discharge. B. A client admitted with septic shock requiring vasopressors. C. A client needing assistance with feeding. D. A client scheduled for physical therapy. Correct answer, B. A client admitted with septic shock requiring vasopressors. Rationale. Unstable clients requiring complex interventions should be assigned to experienced RNs. Strategy. High acuity clients require the highest level of nursing expertise. Question 14. A nurse delegates blood glucose monitoring to a UAP. Who is responsible for interpreting the results? A. UAP. B. Charge nurse. C. RN. D. Healthcare provider. Correct answer, C. RN. Rationale. Although a UAP may obtain the blood glucose reading, the RN must interpret the findings and determine appropriate interventions. Strategy. Delegation transfers the task, not the accountability. Question 15. Which situation requires completion of an incident report? A. A client receives the wrong medication but suffers no injury. B. A client thanks the nurse. C. A visitor brings flowers. D. A scheduled dressing change is completed. Correct answer, A. A client receives the wrong medication but suffers no injury. Rationale. Any unexpected event that could affect patient safety requires an incident report, even if no harm occurred. Strategy. Incident reports improve patient safety, they are not punitive. Question 16. The nurse receives shift report. Which client should be assessed first? A. A client with oxygen saturation of 84% on room air. B. A client requesting breakfast. C. A client waiting for discharge paperwork. D. A client asking for a pillow. Correct answer, A. A client with oxygen saturation of 84% on room air. Rationale. An oxygen saturation of 84% indicates significant hypoxemia and requires immediate assessment. Strategy. Prioritize airway, breathing, and circulation. Question 17. A nurse is caring for 4 clients. Which task should be completed first? A. Document completed care. B. Administer insulin to a client with a blood glucose of 420 mg per deciliter. C. Return a family member's phone call. D. Restock supplies. Correct answer, B. Administer insulin to a client with a blood glucose of 420 mg per deciliter. Rationale. A blood glucose of 420 mg per deciliter requires prompt intervention to prevent complications. Strategy. Address unstable clinical conditions before routine tasks. Question 18. Which statement demonstrates effective conflict resolution by the charge nurse? A. Stop arguing. B. Let's discuss each person's concerns and work toward a solution. C. You're both wrong. D. We'll ignore the problem. Correct answer, B. Let's discuss each person's concerns and work toward a solution. Rationale. Open communication and collaborative problem-solving are key leadership skills. Strategy. Address conflicts early using respectful communication. Question 19. Which task is appropriate for the LPN/LVN? A. Performing an admission assessment. B. Caring for a stable postoperative client. C. Developing nursing diagnoses. D. Teaching a newly diagnosed diabetic client. Correct answer, B. Caring for a stable postoperative client. Rationale. LPN/LVNs provide care for stable clients with predictable outcomes but do not perform initial assessments or extensive teaching. Strategy. Think stable and predictable when assigning to the LPN/LVN. Question 20. A disaster has occurred, and multiple clients arrive in the emergency department. Which client should receive priority treatment? A. A client with a fractured arm. B. A client with severe respiratory distress. C. A client with minor lacerations. D. A client with an ankle sprain. Correct answer, B. A client with severe respiratory distress. Rationale. During triage, clients with life-threatening but treatable airway or breathing problems receive the highest priority. Strategy. In disaster situations, prioritize airway and breathing first. Question 21. A nurse observes a coworker violating sterile technique during a dressing change. What is the nurse's first action? A. Report the coworker after the procedure. B. Correct the break in sterile technique immediately. C. Ignore the situation. D. Document the error without speaking up. Correct answer, B. Correct the break in sterile technique immediately. Rationale. The priority is protecting the client from harm by preventing contamination. Strategy. Patient safety always comes before disciplinary actions. Question 22. Which client can safely be assigned to the LPN/LVN? A. A client receiving chemotherapy for the first time. B. A stable client receiving routine 4 antibiotics. C. A client with unstable gastrointestinal bleeding. D. A newly admitted stroke client. Correct answer, B. A stable client receiving routine 4 antibiotics. Rationale. LPN/LVNs can care for stable clients receiving routine treatments according to facility policy. Strategy. Assign predictable care to the LPN/LVN. Question 23. Which statement by the nurse demonstrates effective delegation? A. Do whatever you think is best. B. Please obtain vital signs on Mr. Jones and report immediately if the systolic blood pressure is below 100 mm of mercury. C. Just help everyone. D. I'm too busy to explain. Correct answer, B. Please obtain vital signs on Mr. Jones and report immediately if the systolic blood pressure is below 100 mm of mercury. Rationale. Effective delegation includes clear instructions, expected outcomes, and parameters for reporting. Strategy. Delegate with specific directions and clear expectations. Question 24. Which ethical principle supports a client's right to refuse treatment? A. Beneficence. B. Justice. C. Autonomy. D. Fidelity. Correct answer, C. Autonomy. Rationale. Autonomy recognizes the client's right to make decisions regarding their own healthcare. Strategy. Autonomy equals the patient's right to choose. Question 25. The nurse receives a prescription that appears unsafe. What is the nurse's priority action? A. Carry out the prescription immediately. B. Clarify the prescription with the healthcare provider before implementation. C. Ignore the prescription. D. Ask the UAP to carry it out. Correct answer, B. Clarify the prescription with the healthcare provider before implementation. Rationale. The nurse must question prescriptions that appear unsafe to protect the client. Strategy. Never implement an order you believe may harm the patient. Question 26. A client becomes suddenly confused and attempts to climb out of bed. What should the nurse do first? A. Apply restraints immediately. B. Assess the client for possible causes of the confusion. C. Call security. D. Leave the room to notify the provider. Correct answer, B. Assess the client for possible causes of the confusion. Rationale. Acute confusion may indicate hypoxia, hypoglycemia, infection, or other urgent conditions requiring assessment. Strategy. Assess before intervening whenever it is safe to do so. Question 27. Which task should not be delegated to a UAP? A. Assisting with feeding a stable client. B. Measuring daily weight. C. Collecting a urine specimen. D. Evaluating whether pain medication relieved pain. Correct answer, D. Evaluating whether pain medication relieved pain. Rationale. Evaluation is part of the nursing process and must be completed by the RN. Strategy. Assessment, teaching, evaluation, and nursing judgment remain the RN's responsibility. Question 28. Which client should the nurse assess first? A. A client with chest pain rated 8 out of 10 and diaphoresis. B. A client requesting a sleeping pill. C. A client needing assistance to the restroom. D. A client asking about visiting hours. Correct answer, A. A client with chest pain rated 8 out of 10 and diaphoresis. Rationale. Chest pain with diaphoresis suggests a possible myocardial infarction and requires immediate assessment. Strategy. Always prioritize potential life-threatening conditions. Question 29. Which action by the charge nurse best promotes patient safety? A. Encouraging staff to report errors without fear of punishment. B. Discouraging staff from reporting near misses. C. Ignoring communication problems. D. Completing incident reports secretly. Correct answer, A. Encouraging staff to report errors without fear of punishment. Rationale. A culture of safety encourages reporting of errors and near misses, leading to system improvements and safer patient care. Strategy. Effective leaders create an environment where staff can speak up about safety concerns. Question 30. The nurse is caring for 4 clients. Which client should be seen first? A. A client with a temperature of 104 degrees Fahrenheit 40 degrees Celsius who is confused. B. A client requesting discharge instructions. C. A client asking for a snack. D. A client awaiting transportation home. Correct answer, A. A client with a temperature of 104 degrees Fahrenheit 40 degrees Celsius who is confused. Rationale. A high fever with acute confusion may indicate severe infection or sepsis and requires immediate assessment and intervention. Strategy. For Nclex leadership questions, prioritize unstable clients, airway/breathing/circulation issues, acute changes in mental status, and life-threatening conditions before routine care. Question 31. Which client should the RN assess first at the beginning of the shift? A. A client with new-onset slurred speech and facial drooping. B. A client requesting a bedpan. C. A client asking for pain medication rated 4 out of 10. D. A client waiting for breakfast. Correct answer, A. A client with new-onset slurred speech and facial drooping. Rationale. These findings suggest an acute stroke. Immediate assessment and intervention are critical to preserve brain function. Strategy. Acute neurological changes are a high priority. Question 32. Which task is appropriate to delegate to a UAP? A. Performing a neurological assessment. B. Collecting a clean catch urine specimen. C. Teaching incentive spirometer use. D. Evaluating wound healing. Correct answer, B. Collecting a clean catch urine specimen. Rationale. Collecting specimens is within the UAP's scope. Assessment, teaching, and evaluation are RN responsibilities. Strategy. UAPs perform routine tasks that do not require nursing judgment. Question 33. A nurse receives a verbal prescription that is unclear. What should the nurse do? A. Guess the intended prescription. B. Clarify and read back the prescription before carrying it out. C. Ask the pharmacist to decide. D. Ignore the prescription. Correct answer, B. Clarify and read back the prescription before carrying it out. Rationale. Reading back verbal prescriptions helps prevent medication errors and ensures accuracy. Strategy. Never assume or guess an unclear prescription. Question 34. Which client should be assigned to the experienced RN? A. Stable postoperative client. B. Client receiving continuous titrated 4 vasopressors. C. Client waiting for discharge. D. Client needing assistance with bathing. Correct answer, B. Client receiving continuous titrated 4 vasopressors. Rationale. Clients receiving high-risk medications require continuous assessment and advanced clinical judgment. Strategy. Assign unstable, high-risk clients to the most experienced RN. Question 35. A UAP reports a blood pressure of 78/42 mm of mercury in a postoperative client. What should the RN do first? A. Reassess the client immediately. B. Document the finding. C. Ask the UAP to repeat it later. D. Continue passing medications. Correct answer, A. Reassess the client immediately. Rationale. Severe hypotension may indicate shock or bleeding and requires immediate assessment. Strategy. Always validate and assess abnormal findings reported by delegated staff. Question 36. Which statement reflects effective delegation? A. Call me if anything unusual happens. B. Measure Mr. Lee's blood pressure every 4 hours and notify me immediately if the systolic pressure is below 100 mm of mercury. C. Take care of everyone. D. Do whatever you think is necessary. Correct answer, B. Measure Mr. Lee's blood pressure every 4 hours and notify me immediately if the systolic pressure is below 100 mm of mercury. Rationale. Effective delegation includes specific instructions, time frames, and reporting parameters. Strategy. Be clear, specific, and measurable when delegating. Question 37. Which client should be seen first? A. A client with sudden shortness of breath after surgery. B. A client requesting a television remote. C. A client waiting for lunch. D. A client asking about discharge. Correct answer, A. A client with sudden shortness of breath after surgery. Rationale. Sudden dyspnea may indicate a pulmonary embolism, a life-threatening emergency. Strategy. Always prioritize airway and breathing emergencies. Question 38. A nurse delegates ambulation of a stable client to a UAP. Who remains accountable for the outcome? A. The UAP. B. The charge nurse. C. The RN. D. The healthcare provider. Correct answer, C. The RN. Rationale. Although tasks may be delegated, accountability for patient outcomes remains with the RN. Strategy. Delegation transfers responsibility for the task, not accountability. Question 39. Which client assignment is most appropriate for the LPN/LVN? A. Newly admitted client requiring a full assessment. B. Stable client requiring routine dressing changes. C. Client receiving thrombolytic therapy. D. Client with active gastrointestinal bleeding. Correct answer, B. Stable client requiring routine dressing changes. Rationale. Routine procedures for stable clients are appropriate for the LPN/LVN. Strategy. Assign predictable care to the LPN/LVN. Question 40. A nurse notices smoke coming from a patient's room. What is the nurse's priority action? A. Rescue the client from danger. B. Complete documentation. C. Call the family. D. Continue medication administration. Correct answer, A. Rescue the client from danger. Rationale. The first step of the RACE protocol is rescue anyone in immediate danger. Strategy. Remember RACE, rescue, alarm, contain, extinguish/evacuate. Question 41. Which client should the nurse assess first? A. A client with sudden confusion after receiving insulin. B. A client requesting fresh water. C. A client asking for pain medication rated 3 out of 10. D. A client waiting for discharge. Correct answer, A. A client with sudden confusion after receiving insulin. Rationale. Confusion after insulin administration may indicate hypoglycemia, requiring immediate assessment. Strategy. Acute changes in mental status always deserve priority. Question 42. Which action demonstrates appropriate professional accountability? A. Reporting a medication error immediately. B. Hiding an error to avoid punishment. C. Altering documentation. D. Blaming another nurse. Correct answer, A. Reporting a medication error immediately. Rationale. Professional nurses promptly report errors to protect patients and improve safety. Strategy. Honesty and accountability are essential leadership qualities. Question 43. Which task should not be delegated to an LPN/LVN? A. Reinforcing previously taught education. B. Administering routine medications. C. Initial client assessment. D. Routine wound care. Correct answer, C. Initial client assessment. Rationale. The initial assessment requires comprehensive nursing judgment and must be completed by the RN. Strategy. The RN performs initial assessments, develops care plans, and evaluates outcomes. Question 44. Which client requires immediate intervention? A. Blood glucose 45 mg per deciliter. B. Temperature 99.1 degrees Fahrenheit 37.3 degrees Celsius. C. Pain score 2 out of 10. D. Heart rate 78 beats/min. Correct answer, A. Blood glucose 45 mg per deciliter. Rationale. Severe hypoglycemia can rapidly become life-threatening if untreated. Strategy. Critical laboratory values always receive priority. Question 45. A nurse is floating to another unit and is unfamiliar with a procedure. What is the best action? A. Perform the procedure anyway. B. Request assistance and guidance before performing the procedure. C. Refuse all assignments. D. Ask the UAP to perform it. Correct answer, B. Request assistance and guidance before performing the procedure. Rationale. Nurses are responsible for practicing within their competency and seeking help when needed. Strategy. Safe nurses ask for assistance rather than guessing. Question 46. Which ethical principle requires the nurse to keep patient information confidential? A. Justice. B. Fidelity. C. Veracity. D. Confidentiality. Correct answer, D. Confidentiality. Rationale. Confidentiality protects the client's private health information and promotes trust. Strategy. Never share patient information with unauthorized individuals. Question 47. A charge nurse is making assignments. Which factor is most important? A. Staff preference only. B. Patient acuity and staff competency. C. Which nurse arrived first? D. Alphabetical order. Correct answer, B. Patient acuity and staff competency. Rationale. Assignments should balance patient needs with each nurse's knowledge, skills, and workload. Strategy. Safe assignments are based on patient condition and staff capability. Question 48. A nurse witnesses a visitor becoming physically aggressive toward a patient. What is the priority action? A. Ensure the patient's immediate safety. B. Complete documentation first. C. Leave the room. D. Wait for security before intervening. Correct answer, A. Ensure the patient's immediate safety. Rationale. Protecting the client from immediate harm is the nurse's highest priority. Strategy. Always intervene first to protect the patient from danger. Question 49. Which statement by a newly licensed nurse requires intervention? A. I'll ask for help if I'm unsure. B. I'm responsible for the tasks I delegate. C. Once I delegate a task, I'm no longer accountable. D. I'll report abnormal findings immediately. Correct answer, C. Once I delegate a task, I'm no longer accountable. Rationale. The RN remains accountable for all delegated nursing care. Strategy. Delegation never transfers accountability. Question 50. The charge nurse has 4 clients. Which client should be assessed first? A client with crushing chest pain, diaphoresis, and shortness of breath. B. A client requesting a sleeping medication. C. A client asking for assistance to the bathroom. D. A client waiting for discharge instructions. Correct answer, A. A client with crushing chest pain, diaphoresis, and shortness of breath. Rationale. These symptoms strongly suggest an acute myocardial infarction. Immediate assessment and intervention are essential to reduce myocardial damage and improve survival. Strategy. For leadership and prioritization questions, remember the Nclex framework: ABCs, airway, breathing, circulation, acute changes in condition, unstable clients, and actual problems always take priority over stable clients, routine care, and comfort needs.